Tell me when you're ready.
Ready.
Okay, everyone, thank you for joining today, COVID-19 and the Emergency Room Department, What You Need to Know. So today's presentation is hosted by 360 Girls and Women in collaboration with our Health Ministries Department and Dr. Enesha Cobb. My name is Sue Ellen Anderson Haynes, and I am the founder of 360 Girls and Women, which is a holistic wellness company for girls and women. We aim to maximize a girl's and a woman's complete wellness through the complete life cycle. We offer information and services that are evidence-based and that are holistic in order to reverse and to prevent and manage women ailments. So if you have any questions about what we do, you could always ask at the end of the session. We just want to make sure that everybody is muted. If you are having background noise, make sure you press the mute button. Also for questions, make sure that you ask your questions at the end. You can turn the volume up at that point, or you could put your questions in the chat box. So now I'm going to introduce you to our speaker. Okay, so Dr. Enesha Cobb is a board-certified emergency room physician who has practiced medicine for over 10 years. She was born in Chicago, Illinois, and is a graduate of Howard University, Harvard Divinity School, and the University of Michigan, where she obtained her BS in chemistry, master's in theological studies, and master's in health and healthcare research, respectively. Dr. Cobb successfully obtained her medical degree from Johns Hopkins School of Medicine. Her residency was completed at SUNY Downstate Brooklyn, and her research fellowship in the Robert Wood Johnson Foundation Clinical Scholarship Program. Dr. Cobb has felt the call to return her attention to God's original plan for our lives through the education and practice of Eden to live, healing through natural methods, and guiding principles of the 8 laws of health. Dr. Cobb currently practices in the emergency department, sitting at the local area hospital, and plans to broaden her focus to offer natural medicine to clients interested in healthier alternatives. Dr. Cobb resides in Tennessee, along with her husband, Stephen, and 2 children. Together, they lead health and wellness seminars at local churches. Dr. Cobb enjoys gardening, preparing delicious plant-based meals, homeschooling her children, and providing Bible and health education studies to local and international communities. So now, Dr. Enesha Cobb.
Good evening, everyone. Thank you so much for joining us. And thank you to Sue Ellen for inviting me for this very important seminar via the web. I'm glad that all of you could join us. We'll be talking about COVID and the emergency department this evening. Bear with us. There have been a couple of technical difficulties as we just tried to, check on the system before this started, but it looks like everything's working well right now. I'm going to go back to my slides so that you guys can follow along. And if you have any questions, we are open to questions. If you could just hold your questions to the end, or if you have a question, you can write it in the chat box and we will take a look at those at the end. Okay, can everyone see the screen?
Yep.
Okay, perfect. So just to give you an idea of what we'll cover today, I'll give you a little bit of background about myself. Actually, Sue Ellen has already done a great job of that. We'll do a brief overview of the coronavirus. We'll look at some things that we can do to prevent the spread of coronavirus. Some things that you would like to know if you do end up having to visit the emergency department. Also, we're going to touch on things that we can do to boost our immune system. And lastly, we'll do some Q&A. Any of your questions, we'll be happy to answer them. Let's see, okay. And just a quick note, I do want to say that, this is an informational webinar. It's for educational purposes. And nothing here should be a substitute for seeking the advice of your physician or other qualified healthcare provider. So I think Suellen covered this. My background's in emergency medicine, but as I've been reading and studying more about health principles from the Bible, it's really motivated me to go deeper into that area and to really look at the things that God has provided us that can both prevent and treat illnesses. And that's why I've gotten more interested in natural medicine. To that end, I've been treating things as simple as thrush in the mouth of a baby, of a young baby, and all the way to hyperthyroidism with natural methods. So just a little brief overview. I think we're all flooded with information about what coronavirus is, but it is an infectious disease now, and we're calling it COVID-19, or SARS is another name that people have given it. It's thought to have crossed over from animals to humans, possibly from bats, possibly from pangolin, which is another Asian animal. And it's highly infectious, and it spreads similarly to flus and colds, right? So if you sneeze or if you cough, you're putting these little droplets into the air, and then someone else comes along and they breathe them, or they touch something where one of those droplets has fallen down, and then they touch their eye or their nose. And those are the ways that we are aware that it can be transmitted at this time. Notably, coronavirus has a longer incubation period than the regular flus and colds that we're used to. So this virus can be carried around from 2 days to 2 weeks before symptoms may occur. And that's really significant, because someone can be an asymptomatic carrier, no symptoms, for 2 weeks before developing any symptoms. So imagine that 2-week period that they're walking around, interacting with other people. You can imagine that, the spread of the virus, it would be very effective during that period. So a little bit about prevention. So social distancing is still the #1 way to prevent the spread of coronavirus. Again, you can see in this little animation here the respiratory droplets that somebody has either coughed or sneezed or even breathed out. Can travel some distance. We're thinking that distance is about 6 feet. And so that's how we get that number, just in case anyone's wondering, how we get that 6 feet of distance between people that should be maintained when you're out and about for your essential grocery trips. Obviously, we also want to wash our hands with soap and water for 20 seconds. That's about the length of time that it would take you to sing happy birthday to someone. And you want to do that often, right? And you want to make sure that you're washing not just the palms of your hands, but also the backs of your hands as well. And then, very importantly, try not to touch your face, your eyes, your nose, your mouth. Those are the areas where the virus is going to take hold and be transmitted. And so you wouldn't believe it, but we touch our faces about 16 times an hour. That's a lot. That's 16 times in 1 hour that the virus could be transmitted to you if you have, touched some surface that where the coronavirus has landed. And then, of course, after removing your mask, you want to wash your hands and your mask, and if it's not a disposable mask. And then you want to clean those areas where people congregate, where they socialize a lot, where people are touching a lot, right? So what would some of those areas be? Door handles or doorknobs, definitely countertops. If you're bringing groceries home from outside, wipe those down after you get those grocery bags put away. And then just that last note that coronavirus can live on surfaces for up to 72 hours. Okay, so just a little bit about some disparities that we've noticed with respect to contracting coronavirus or COVID-19. So men seem to be more susceptible to infection. We're not exactly sure why that's the case. But also communities of colors, specifically Black communities and Latino communities, are disproportionately affected by this virus. Now, some reasons that have been given for this: lack of healthcare access and insurance, high rates of risk factors for complications to COVID-19. So what are those risk factors? Those risk factors would be lung diseases like COPD or asthma, heart problems, any kind of immunocompromised state. If you have cancer and you're taking treatments, think that's something else that will lower your immune system's response. Severe obesity, diabetes, chronic kidney disease, especially if you're on dialysis, and then also liver disease. So those are illnesses that we're already seeing in high rates in our communities. And these are the same illnesses that put us at higher risk for COVID-19 infection. So then there's also the fact that many of the workers in our communities do work that doesn't allow them to stay at home. You see, I have this picture of some workers in a grocery store, right? So that's obviously a career or a job that can't be done from home. Also, community leaders need to be seen being tested for COVID-19. I think that also would lend itself to lowering distrust in the healthcare community, because traditionally, historically, communities of colors have had a distrust of the healthcare community, and that has impacted our health over the years as well. Okay, so now what about masks? So there's a lot of discussion about masks and how effective are they, and are we required to wear them? Some states are requiring that if you go outside now, you need to wear a mask or some kind of face covering, right? So the CDC, these are all guidelines from the CDC, recommends that if you go out, you need to wear a face covering, such as a homemade mask, especially in places where it might be difficult to maintain that 6-foot distance from other people. And of course, you still want to maintain good hand hygiene, and they're still recommending that N95 respirators, those special masks, and I'll show you a picture of those later if you're not familiar, be reserved for hospitals and healthcare workers. So this is a picture of the N95 respirator. Now this mask can protect against infection with SARS when used appropriately. Now, the thing about these masks is that usually for this to be used effectively, a person needs to be fit tested to make sure that there's a good seal around that mask. And that's usually done by a trained professional. So even if you have an N95 mask or an N95 respirator, you may not be wearing it properly, especially, if you're a man and you have a beard, you may not get that seal around that mask that would protect you from infection by coronavirus. So a surgical mask, similarly to the cloth mask, what you're doing is you're protecting other people from coronavirus if you have it, right? So it's not actually that the mask is protecting you from infection with coronavirus. It's if you have it, you are keeping your respiratory droplets from spreading to other people. And I hope that's clear, because I've heard a lot of people say, "Oh, I'm making myself a mask, or I made this mask, or I bought this mask, and I feel protected now, or I'm protected now." Well, it only works if everyone is wearing the mask, right? Because it's those respiratory droplets that keep from being spread when you cover your face with the mask. Hopefully that's clear. And if not, we can come back to that at the end. Okay. Nonetheless, the CDC still recommends wearing face masks or some kind of face covering in public. And again, there's a shortage of these masks, these special N95 masks and surgical masks, and they're being reserved for first responders and hospital and healthcare workers. Okay, so what do you need to know about visiting the emergency department? So one thing I would say is that, there are so many news sources covering the latest developments around coronavirus, and I would encourage all of you to just stay abreast of the new updates. So for example, as more and more research is done, we're finding that there are more and more symptoms associated with COVID-19, right? Mm-hmm. So when it first came out, the CDC was really focused on just fever, cough, and shortness of breath. But we now know that there are so many more symptoms associated with it, right? So now we talk about fatigue, talk about chills, sore throat, headache, muscle aches, and another one that really distinguishes COVID-19 from other viruses with similar symptoms is that loss of taste and smell. So what can you do at home before you go to the emergency department? I think one thing that's really key that a lot of people have been focusing on, like even if you go to some places, maybe if you do have to go to a doctor's appointment or something like that, people have been taking temperatures at the door. One thing I would also recommend, if you are able to purchase one, is a pulse oximeter, especially if you're having some symptoms and you're starting to wonder, is this COVID-19 or is this some other flu like influenza, or is this just a really bad cold? A pulse oximeter is a small device. You put it over your finger and it measures the amount of oxygen in the blood. And I've been reading articles that have said that the drop in your oxygen level in your blood is a really good sign that this is a more serious thing than just a regular influenza or cold. Excuse me. I know that, the shelves at one point were bare, but maybe at this point they have restocked them. So I think a pulse oximeter, and some of you, if you have any respiratory illnesses, you may already have a pulse oximeter, and it could be very helpful. Also, if you're a healthcare worker and you're, being exposed and you're kind of wondering, you can measure your pulse oximeter and it will be a good telltale sign of what's going on in your lungs, because we're finding that so many people are, they're having some difficulty breathing, but maybe it's not serious, and then suddenly, precipitously, they're having severe respiratory distress. But if you had taken their pulse oximeter earlier on, you would have seen that drop even though they weren't yet symptomatic, severely symptomatic. Okay, so if you are experiencing some symptoms, and hopefully none of us will, but if you do, don't panic. I do recommend keeping a log or a journal. If you do develop a fever, write that temperature down. Actually take your temperature with a thermometer so that you can have some objective evidence when you do go to the emergency department and say, hey, I had a temperature of a 101.2. And even the pulse oximetry is helpful as well. Write down what your symptoms are, because at some point when if you became sick enough to go to the emergency department, you may not be thinking so clearly, you may be tired, you're not feeling well, and so that log or that journal of your symptoms could be helpful. And then you want to wear masks during your visit. And then you also want to be prepared to be evaluated by a physician or by a healthcare provider without your family members present. And I think that's also where that journal or that log can be helpful. So, a lot of times we're only allowing the person who's being evaluated for the illness to come into the emergency department. And that's just a preventive measure to try to keep the potential spread of illness down. And then when you get there, you want to be able to give an account of what has happened. Have you been traveling recently, or are you a healthcare professional, or, were you exposed to someone? Did you visit someone in a nursing home? The rates of COVID-19 in nursing homes is through the roof. That's definitely something they would want to know. You want to just paint a picture, a clear picture, as clear as possible, of what's happened, so that the person evaluating you, that healthcare provider, can have a good understanding of your history. And of course, you want to have relevant information ready: your last menstrual period, past medical history, if you're actively receiving treatment for cancer or any other chronic illness, we'll want to know that. You want to bring your medications. If you haven't written them down, you want to bring them, just bring the actual bottles with you to the visit so that we can take a look at what you're taking. And also, if you're using any supplements, especially, in this day and age when so many of us are looking for natural alternatives to pharmaceuticals, you want to make sure that you're making your healthcare provider aware of supplements that you're taking. And then, especially if this is a child being evaluated, you want to know their immunizations, what immunizations they've had in the past. And speaking of children, we're going to just talk a little bit about caring for children and what that looks like. So children can show a wide range of symptoms. It may be something just as simple as not eating or drinking well. But yes, they can have some of the same symptoms that adults have shown: shortness of breath, cough, fever, headaches, and myalgias. Those are muscle aches. But also diarrhea. Children can have diarrhea with this virus. So you want to just be very, cautious and vigilant. Now, these numbers that I have listed here are based on a large study from China. This is the best data that we have right now. It was a study done with over 2,000 children. And they found that of the children that had COVID-19 in the study, 4% had no symptoms. They were completely asymptomatic. 51% had mild symptoms, and mild symptoms in this case, they characterized as fever, fatigue, muscle aches, and cough. 39% had moderate symptoms, which they characterized as pneumonia. And then severe symptoms, dyspnea, central, it's kind of like a lowering of the oxygen in the blood. That's 5%. And then critically ill, so very small percentage of children who are considered critically ill with respiratory failure, shock, and multiple organs went into dysfunction. And that's probably what you've been hearing most recently a lot about in the news, particularly a lot of cases of this multi-system inflammatory disorder in children, particularly in New York. I've heard a lot of cases of that. And this, I just want to note, can present weeks later, weeks after the initial symptoms of COVID-19. So we always have to stay vigilant. We always need to stay vigilant. So just a couple notes for women with infants. So if you're a mom and you're breastfeeding and you have been diagnosed with COVID-19, but you still want to breastfeed, you have to take some precautions when you're breastfeeding that child or when you're bringing the child close to you. You want to wear a face covering, you want to wear a face mask, you want to wash your hands before, picking up the baby, before feeding the baby. And if possible, maybe during the time that you're ill, you could actually have some other healthy adult feed the child during that time. But if it's not possible, we recommend wearing a mask during the breastfeeding, wearing a mask during feeding, hand washing prior to all of that. Okay, we're going to move on to boosting your immune system. So what are the things you can do, right? Because we all want to stay out of the emergency department as much as possible. And I just want to note here that, these are recommendations that are based on other viral infections that are similar to COVID-19. So viral infections like the flu, for example, influenza, which, part of the DNA of COVID-19 is similar to influenza. And so that's what these recommendations are based on. But, it's too early right now. Studies have not been done, scientific studies have not been done on the actual COVID coronavirus and these recommended things that I'm going to share with you. So just the basics, we want to make sure that we are keeping our bodies in the best possible condition. So that means eating the right foods, right? Staying away from junk food, trying to eat whole foods as much as possible. These are the things that you're going to have to wash off before you eat them, right? The fruits, the vegetables, things like whole grains, quinoa is great. So much nutrition and protein all wrapped in one little grain. It's really pretty an amazing food. So nutrition is really important. It's going to give you vitamins, and then you want to eat a colorful palette, right? So your food should not look all one color. It should be colors like the rainbow. You should be eating the rainbow at every meal. Okay, exercise. Exercise has obvious health promotion. It's not just, staying fit in terms of losing weight, but, exercise also produces endorphins. It boosts your immune system, and it helps to ward off depression and anxiety as well. With so much of the news, and we're getting these constant news feeds and updates and whatnot, it can bring on anxiety, and exercise is a great way to combat that. Water. So you want to make sure you're drinking enough water, you're staying hydrated. Our bodies are 70% water. We need to keep that hydration going so that our bodies can flush out toxins easily and our cells can use can use the nutrients that we're giving them when we eat those whole foods. Sunlight is a great natural source of vitamin D. Obviously, you want to limit your sun exposure. About 20 minutes a day is what we recommend. Trust in God. At the end of the day, no matter what you're experiencing, you can always run to God. Prayer has also been linked to more healthy living, more healthy lifestyles, and as well as going to church weekly and being a part of a faith community have all been linked to healthier lifestyles and longer lives. Fresh air, also very important. Rest, and this is rest, not just the rest in terms of sleeping at night, but also a weekly rest. In my faith, we take a weekly rest every Saturday. Every Sabbath, we come away from the world. We let go of what's going on in the world, and we just focus on God and fellowship, and it's refreshing. We also want to think about maybe a yearly rest. Maybe you take a vacation every so often, but we need that downtime. So also the more traditional type of rest, sleep. You want to make sure that you are getting 7 or 8 hours, that you're going to bed at the same time every night roughly, and that's called sleep hygiene. Because it will be easier to fall asleep if you're on a schedule like that, if you're on a routine like that. And then we know that rest is restorative. It's when your body is going to regenerate itself, when it's healing, when your thoughts are organizing and you're making memories. So many reasons why rest is important. And then lastly, temperance. So temperance in everything. So we want to make sure that we're not overeating. We want to make sure that we're, not overworking, that we're not overindulging. So all of these things, that when you overeat, you're actually putting a tax on your body to process all of that food, and your blood is going to the organs of the stomach and the digestive system to try to break down all that food, and it's almost like a blockage. And we know that perfect health comes from perfect circulation. So you're not getting that good circulation when you overeat. Something to think about. And that's another point for exercise, that it also improves your circulation. Okay, so what are some of the supplements that we can take to boost our immune system? So vitamin C, I think many of us know the powerful antioxidant properties of vitamin C. It has also been shown to shorten the length of respiratory infections. Vitamin D, which I mentioned before, which we get from sunlight, but you can also take a supplement if you're someone who doesn't get outside much, or you can take a supplement for that. It's essential for immune function, and it can help lower the risk of respiratory infections. Thirdly is zinc, also important for immune cell development. And we found that older adults are often deficient in zinc. So they may also need to take a supplement, may not be getting enough in their diet. Zinc has also been shown to lower the risk of respiratory infections and shorten the length of infection, right? So I'm sure many of you, may take zinc lozenges when you feel a cold coming on, or a combination vitamin C zinc lozenge when you feel a cold coming on. Now I'm going to talk briefly about a few supplements that you can take as well. These are more they're some of them are herbs, and some of them are flowers. So for example, echinacea and sambucus. So I think a lot of us know about garlic. It has many, many immune boosting properties, but also it's helpful in things like lowering blood pressure. So it detoxifies the body, protects against infection, and garlic is particularly beneficial for lung and respiratory illnesses. And then sambucus. Many of us know this as sambucol. There's a commercial preparation called sambucol. It's also called black elder. There are lots of different preparations for children that have been made out of black elderberries. It has been known to be helpful in colds and flus, and it reduces upper respiratory symptoms caused by viruses. But if you're not familiar with how to use a fresh herb, I just want to caution you, do purchase a commercially made preparation of sambucus. It can be a dangerous herb in its fresh form if you're not versed in how to use it properly. This is actually one that we take often in our home. The kids, it's something that's easy for the kids to take because it's a berry and it kind of tastes like a berry. So it goes down easier than the garlic. Okay, the next one is oregano. Oregano has a lot of antioxidants in it that help to fight off bacteria and viruses. In addition, it can also reduce the growth of cancer cells and help alleviate inflammation, which is really important because when we're sick, when we're getting sick, it's our body's immune response that often is actually giving us a lot of the symptoms that we experience. And so something that lowers the inflammatory response can be really helpful and make you feel a lot better faster. So oregano, as we know, is also used as a spice. It can be added to recipes, and there's also an oil form of it. And then there's an oregano oil extract, which is more of the medicinal version of oregano oil. And then lastly is echinacea. It has been shown to have positive effect on immune systems. It does help combat viruses. It has anti-inflammatory properties. And there's a study that was done on a hot drink. It was an echinacea-based hot drink, and it was versus something called oseltamivir, which is a treatment that we do use to treat influenza. And it was this study was done in 2015, and it was shown to be just as effective as that drug that is a pharmaceutical used to treat influenza. So echinacea is a really powerful flower that can be used for combating viruses. And this is not an exhaustive list, but these are the ones that I thought were the most effective based on my research and my own personal experience in using them. So before we get to the question and answer period, I'm going to turn things over to Sue Ellen to share with us an immune boosting recipe.
So this recipe I actually used some time ago, and it's very potent. I'm not sure what ingredients cause this potency, but I believe it's the mixture of everything. And I think that everyone should try to blend this up and keep it in the refrigerator to use as needed, or if you want to take it weekly and then take a break and take it again in another few weeks. But definitely check with your healthcare provider before taking any of this combination, because it could interact with medication if you're taking medication. So it's called Happy Lungs, and the first ingredients you want to use is a cup of raw unfiltered honey. So you would get like a mason jar, and mix these items. And I prefer raw unfiltered honey because raw honey is strained before it is bottled, and it has all the potent nutrients and antioxidants still active in raw honey. Then you want to use a half cup of chopped garlic. As we talked about, garlic is very potent, anti-inflammatory, immune stimulant. And then onions as well, half cup of onions and half cup of horseradish. Cayenne pepper helps to stimulate everything, kind of boosts the stimulation of the ingredients. And then lemons with the vitamin C, two large lemons, squeezed with the seeds out. And then the last thing is a 1/3 teaspoon of peppermint oil. So the peppermint oil I have here is a Vitality Young Living peppermint oil. This oil is generally recognized as safe by the FDA for consumption. Not all oils are not safe for consumption. So make sure if you're getting a peppermint oil that it is something that you can ingest, and this one is. So you'll take the mixture and you'll mix it, and again, you can refrigerate it. And then half teaspoon, usually you could give this to kids, half teaspoon, and like a teaspoon if for adults, or you could just use less than a half teaspoon to try, because it is very strong. If your children won't take it, the best thing is to try something else like the elderberry, as Dr. Enesha Cobb mentioned, but this is definitely one of my favorite mixtures for just a strong, healthy lung, especially when you feel like something, like you're getting a cold or something is if you're coming down with something. So if you have any questions about this mixture, you could ask us at the end, which we are about at the end now. So
I'll just leave that on the screen for a couple seconds,
So,
and we can go into our question and answer.
so question and answer. Okay. If you have questions, you could put those questions in the chat box, or you can unmute yourself and ask the questions if you feel it's better. Enesha, I think you have control over the chat box.
All right. As the host, you can mute. Okay. So there's one question here that's about vitamin C. It says, is there a certain type of vitamin C we should use? And maybe you can elaborate on that question. That was from Deborah/Alex. So what do you mean by that? Do you mean a certain brand, or do you have any? Are they still on? I don't think they're on the. Maybe they had to go. I don't. Oh yeah, they're still there. Deborah and Alex, Pastor Alex and Sister Deborah. Okay.
Okay.
Not sure. In terms of vitamin C, you can take up to 10,000 milligrams of vitamin C a day, which is a lot. I wouldn't take it every day, but if you feel something coming on, you can take up to 10,000 milligrams. Now, that is not to say that you will not have side effects from taking a lot of vitamin C, right? High dose vitamin C can irritate your stomach. And so you want to be careful about that, because you don't want to, then be battling diarrhea with that. And then it can also lead to kidney stones if you're, taking high doses for a long period of time. Hopefully that helped answer that question. Then we have another question that says, what's the best way to use garlic as an immune booster?
You want to answer?
Yeah, I can answer that. So we use it if we feel that something is coming on. So if we feel like a scratchy or sore throat is coming on, or we start to have some nasal congestion or runny nose, we actually just take it raw. Now, everyone cannot tolerate that. That can be very, it can be very strong. Yes, very strong. If you have not been, if you're not used to taking it. but I've actually gotten my kids to do it. Now, what you can do if you're not able to tolerate raw garlic like that, you can blend up a clove of garlic with a little bit of orange juice, preferably freshly squeezed orange juice. Blend it up a little bit together in a couple of ounces of orange juice, and then just try to drink it down. I don't know if you have any special techniques for using garlic,
Um,
Llewellyn.
well, I like to chew mines. A lot of people can't tolerate that, but it's
Yeah,
very strong to chew it. But for the terms of children, I would put it with honey, crush it and put it a clove, well, half a clove for children, a full clove for adult, and I would say start there. But it does get so garlic has sulfur compounds, and these sulfur compounds are more potent when they're raw. So when you cook garlic, a lot of these compounds are deactivated. So you want to take garlic raw if possible to get all the benefits. And so again, it does take time for you to learn how to consume it raw. There are garlic supplements, but again, it's a supplement. So the best form is to get it from food if you can. So that would be my recommendation.
yeah, absolutely. I definitely think that taking it raw, I've had much better effects with
Mm-hmm.
taking raw garlic as opposed to,
Yeah.
um, as someone said, is it realistic to chew on garlic if you're working around people?
um, there's things that you can take for, I think, parsley. Parsley helps to freshen the breath, and you can choose some raw parsley after, and that could freshen the breath naturally. But sometimes it does give a bad after effect on the breath. This is something that they may have to deal with if you are having concerns that you want to address.
Yeah.
Speak further away from them.
Yeah, I'm sorry. I just had to chew on some garlic because I'm really concerned about my health. And that brings up a good point too, that if you are feeling sick, you should probably stay at home
Mm-hmm. Yeah.
because it's not only good for you because, your body is giving you an indication that you need to rest,
Mm-hmm.
but it's also a protective um, action to keep other people from getting whatever you may be getting, whether it's a cold or flu or what have you.
Any other questions, you could feel free to ask, or someone asked another question about roasting garlic. Do you see that, Enesha?
Roasting garlic. What about roasting garlic? I haven't tried roasting garlic in terms of using it when I'm,
Remedy.
trying to fight something. I tend to, use the raw garlic, and I do know that, high heat can destroy some of the
Mm-hmm.
benefits of, any vegetable, any, you know, it can denature proteins. So I would imagine that roasting garlic may work, but it may not be as potent as raw garlic.
Mm-hmm.
Uh, Someone said, I cut a clove in a few pieces and swallow with water. Been doing this a lot now since COVID-19. Yes, I think that's an acceptable method as well.
Mm-hmm. I want to note that that garlic can drop your blood pressure and your blood sugar. So if you're going to take the raw garlic, make sure you have something in your stomach too, because it may give you a side effect if you haven't had anything in your stomach at all. And if you have diabetes or any blood sugar issues, it could lower your blood sugar slightly. Definitely your blood pressure, but
Yeah,
I would say if you're going to take raw garlic, um, always check with your healthcare provider, of course, but you should take it with food.
Yes. Well, and people have different responses.
Wow.
And
Yes.
so you're going to want to just
Yeah.
note what your response is. I had a patient who she was actually allergic to garlic. She ate something and it had a little bit of garlic in it, and her blood pressure dropped, and she started feeling pretty flushed, and it was pretty remarkable, actually.
Mm.
I wish I could have that effect on some other people with high blood pressure, but but yes, everyone's going to have maybe a different response. I do see another question that says, can you speak about elderberry and cytokine storm syndrome? So with with uh, with any of the things that can boost your immune system's response, what you're doing is you're trying to um, bring your white blood cells and all the other things like cytokines, you're trying to activate them essentially. So, for example, with the elderberry or with the garlic or the vitamin C, you're trying to get your immune system to respond to whatever the pathogen is before the pathogen has a chance to really replicate in your body and take over.
Mm-hmm.
And so I guess some people are concerned that, oh, if I'm doing that, I'm creating that inflammation that I mentioned earlier, where you're trying to avoid that inflammation. But initially, you want to try to, get that immune response to combat whatever the pathogen is. And you want to do that long before, you're so ill that your immune system is now responding with a cytokine storm. So a cytokine storm is something that's going to happen down the line when you're really ill, when you're really sick, maybe even septic at that point. And so, we're doing this on a small scale to try to boost our immune system before we get to that point.
Mm.
Let me just go back up and make sure I didn't miss any earlier question.
I saw something about N-acetyl something.
Yes. Just one moment. Can you speak? Okay. The Happy Lungs recipe, someone wanted to get that recipe after.
Mm-hmm. Yeah, feel free to take a picture of the recipe, or I can email it. I have those that registered. I have your email address. I could send the recipe to so for those who requested. I could send it by email so you can share it.
Okay. Have you heard of N-acetylcysteine for respiratory issues? I have not heard of using NAC for respiratory issues. Generally, we have used it in the emergency department to treat acetaminophen overdose. It's also been used to treat things like kidney injury after taking iodine, a contrast, iodine contrast. So I haven't heard it used for respiratory issues. Any other questions about COVID-19, going to the emergency department, prevention, immune system, boosts? Okay, well, we're coming at just about the 1 hour mark, and I do want to respect everyone's time. Do you have any closing remarks, Sue Ellen?
Yeah, sure. I just want to say thank you for everyone that registered for this free presentation. I want to thank Dr. Enesha Cobb for her time, giving us feedback and helpful hints and tips to boost our immune system. You know that all the precautions that we need to take, that everyone is talking about, the state of the government using, masks appropriately, washing hands, gloves, but one thing that you don't see on the media or maybe so on the TV much is the instructions of how to improve your immune system. So I felt that it was very important that we had someone that we continue to talk about or continue to dialogue about ways we could improve our immune system, because that's what matters. Hopefully, we keep our immune system up so that if for some reason COVID-19 comes our way, we can fight it, as Dr. Enesha said, and use remedies to have a positive response. I also want to thank the Health Minister's Department and Marva for allowing me to collaborate. If you have any questions about what 360 Girls and Women is all about, I gave an introduction in the beginning. If you missed it, this session is recorded. And if you would like to talk, you could send me an email and we will follow up accordingly. Until then, thank you very much. And we don't have any other questions, so we are going to end today's session and keep up to date with free sessions. I plan to give free sessions a few times a month. You can follow our page at 360 Girls and a Woman on Instagram and on Facebook. And you can also send an email at complete at 360girlsandwomen.com. Thank you. And then if they want to reach out to Dr. Enesha Cobb, you can send me an email and I will get in contact with Dr. Enesha Cobb. That way is the preferred way. So again, thank you, Dr. Enesha Cobb. Thank you, everyone, for joining. And please spread the word on boosting your immune system and taking care of ourselves. God bless.